Are you battling from long COVID symptoms? Well, I'll tell you how to manage your symptoms and recover according to the experts. As coronavirus cases hit a downward spiral in the country post the second wave, many are battling a deluge of post-COVID symptoms and complications. Some are even being rushed back to the hospital, while some are encountering some lingering symptoms of the viral infection. Persistent bouts of coughing, chest pain, weakness, joint aches, insomnia, and mood fluctuations being some of the most common ones, which sadly also damper your daily life. While statistics suggest that 1 in 5 COVID survivors may be hit by long COVID, the break awareness and the lack of help many doctors believe is going to make the COVID crisis worse. Thus, not only there is a dire need of raising awareness of the same, every COVID survivor needs to prioritize rest and healing and manage symptoms long after testing negative for COVID-19. So basically, what is long COVID and are you at a risk of it? Long COVID or post-COVID syndrome has been medically dubbed to the phenomenon that plagues COVID survivors for weeks and months even after the infection is cleared off. Some patients who have battled a moderate or severe form of infection can continue to encounter lingering signs of infection for a while after and face problems after resuming the normal pace of life. Let's look at how to manage fatigue and breathlessness. A COVID-19 infection can impair vital functioning, but the gravest risk is your respiratory health. Lung capacity can be greatly reduced, and if you have battled a severe infection, it can take a long time to build your capacity back. Hence, encountering frequent breathlessness, chest pain, fatigue can be common. This being said, remember that your body will need time to get its strength back. So firstly, do not exert yourself and slowly pace yourself back into work and a normal routine. Do not rush in or perform tasks that will strain you. You can also consider splitting tasks into smaller activities and prioritize work in the part of the day when you have the most energy. Those on continued oxygen support should not stop it. Lung strengthening exercises, breathing exercises, and yoga asana may also be tried. However, do only exercises which are suitable and which don't strain you. Your age, the type of infection, pre-existing risk factors, and all of them can determine the risk of long COVID. Past studies have shown that people who have more than 5 symptoms in the first week are most vulnerable to the ills of post-COVID symptoms. The most pressing symptoms, however, remain to be fatigue, brain fog, breathlessness, insomnia, anxiety, coughing, recurrent infections, and also may require some support. Good care and therapeutic help along with clinical diagnosis can help people heal faster and alleviate the symptoms. If you're someone who has recently recovered from a COVID-19 battle, here are some tips which can help you to recover faster and manage symptoms better. Now, body pain, headaches, joint aches, and muscle cramps are signs of myalgia. Inflammation caused by the virus can persist for some weeks after you recover. However, do not worry, as these symptoms can be taken care of by making use of a warm compress, taking good rest, and ample breaks. As mentioned earlier, do not exhaust yourself beyond means. Pushing yourself beyond limits will only further tire your body out. Apart from therapeutic care, it's also beneficial to include some forms of flexibility exercises and strength training workouts into your regime. They will help build strength back and alleviate pain as well. Consult your doctor before trying any of the exercises out. These are most likely temporary, but nonetheless could be disturbing and stress a person out. The most important thing to remember is to not let memory and cognition issues add to your worries and not get too stressed. So if you're constantly finding it difficult to remember things, or you are experiencing frequent brain fog, a practical tip is to try and write or jot things down which you might need to remember. This can come helpful if you're resuming work as well. Break down tasks into smaller ones, prioritize which is important, and avoid distractions. Also remember to limit your screen usage, change diet, and curb additives that decrease concentration skills. Manage stress levels as well if possible. But if you need extensive help or continue facing such mental health problems or memory issues, seek help from a qualified doctor, please. Next comes how to get your sense of smell and taste back. Though not extremely persistent during the second wave, a lot of people have been infected by COVID-19 can suffer from a diminished sense of smell and taste. Some can altogether feel a change in the sensory taste buds. These symptoms can also take a while to heal, depending on your condition. Most people tend to fully get their sense of smell and taste back by 6 to 8 weeks after infection. Even I did. While there is little medicinal help available to cure this symptom, experts do recommend people to try out therapies like smell training, aromatherapy, frequently to help gain some sense back and fasten up healing. If poor taste buds are putting you away from having proper meals or have lowered your appetite, consider making tweaks in your diet for a while and take help from a nutritionist. Apart from the previously listed steps, it's also crucial that patients and caregivers keep following all their medications needed. Post COVID screenings, doctor checkups, and tests are also helpful to ascertain your health and seek proper care. Most of all, remember that recovery from COVID 19 isn't easy and it can take a while. There can be a lot of good days and some bad ones as well. Managing your mental health apart from physical symptoms is crucial. Connect with your loved ones, seek support for your emotional well being, and take care of your mental health. It is important.